Hello, Keith Livingston here from Hypnosis101.com, the place to learn hypnosis and NLP. In this video tip, I'm going to help you avoid one of the most common traps that people in the profession of hypnosis fall into. Today's topic is, it's a trap. You know, folks often ask me what techniques they can use for, and you can fill in the blank here, for smoking or weight loss or nail biting or whatever. They say, please tell me what techniques I can use to deal with this most effectively. Now here's why this is a trap. Knowing what tools to use in what order is similar to using a recipe. Now sometimes NLP and hypnosis processes are described as recipes, and here's the thing about recipes. It's generally you, some tools, and some ingredients. You know, chop up the carrots, dice the potatoes, add flour, stir. Now as far as I can tell, carrots don't have motivations for being in your meal, and different carrots certainly don't have different motivations. As you get the idea, I'm sure, people are not carrots. People do have motivations. Those motivations differ from person to person. They have differing life experiences. They have different triggers for behavior and different reasons to want to change. You may need all of that information in order to help them in the most effective way. And that's why scripts and procedures can be a trap. They don't take into account the differing motivations. They don't take into account the different life experiences, the different resources, the different triggers. And you can't really script an NLP or hypnosis session any more effectively than you can script a conversation. It's a trap to go in there with a script. So, I could say, for smoking cessation, first gather information, then do parts work, then direct suggestion, but it would be a trap. You might feel like you knew what you were doing going into the session, but once the session got off script, you just might feel lost. So how do we get around that? We focus on process, not content. So here's a big picture process for any kind of intervention. First, set a treatment goal. And in NLP, we call this the well-formed outcome procedure. 2, do an intervention. And 3, test. Now step 1 will give you direction as to what to do in step 2. If the treatment goal is to stop smoking, for instance, while you're well forming that goal, they might tell you that, well, one part of me wants to stop, but another part of me really likes it. Well, that might mean parts work is called for. If you see signs of age regression when they talk about their problem, then a regression-based technique could be a good approach. When you run into beliefs that are getting in the way of desired change, reframe with sleight-of-mouth patterns or do re-imprinting to change a limiting decision. If they experience a negative emotion, an anchor collapse might help. So if you're asking, how do I work with blank, you might be focusing on content rather than process. I encourage you to take another look at it. Okay, we'll see you next time at Hypnosis101.com. Bye-bye.